allemaal, welkom bij de Werelddiabetesdag. Eén keer per jaar staan we stil bij de gevolgen van diabetes voor onze samenleving en voor andere samenlevingen wereldwijd. We gaan luisteren naar een presentatie van het rapport van Boezem Company. Maar natuurlijk gaan worden ook eerst welkom geheten. En dat worden we door Kingo, de Executive Vice President van Novo Nordisk en verbonden aan de Medical Faculty of de Vrije Universiteit. Big applaus.
Good afternoon, ladies and gentlemen. It is a great pleasure for me to spend the World Diabetes Day here in Holland. As was just mentioned, I feel very much at home in Holland. I come here on regular occasions to take care of my professorship tasks at the Vrije Universiteit. And I must say it was a pleasure to be there this morning and see how well the students are investigating some of the themes that we will discuss this afternoon. I believe it is my role this morning to put things in a bigger perspective, to give you an idea of how Novo Nordisk as a global company is working to try to change diabetes. I assume that many of you know our operations here in Holland very well, and I hope I can entertain you a bit with talking about the company as a global healthcare organization. And let me just start with saying a few words about who we are as a company. Novo Nordisk has existed since 1923, and with diabetes as our core area right from the beginning. We are based on a very strong scientific tradition in research into diabetes that has been with us since the company was created many years ago, and we are actually up for a 90-year anniversary in a few years. As you can see, we have a very nice sales and growth in the company, 8 billion euros last year. We are more than 30,000 employees all over the world, even though we are a company that has grown out of Denmark and very much out of a Scandinavian tradition. We are now more people around the world than we are in Denmark. We have also global research and development across the world. We have production across the world. And I think it's fair to say that Novo Nordisk is the market leader within insulin. The ownership structure of Novo Nordisk is quite special due to the fact that we are owned by a foundation. The Novo Nordisk Foundation has 70% of the votes of all the Novo Nordisk shares, which gives us an opportunity to work in accordance with the guidance of the foundation and always to take a very long perspective in everything we do. One of the things that are in common for the companies in the Novo Group is that we work according to the triple bottom line. And I'd like to explain to you what that might be in case you are not familiar with this idea already. It is simply what some companies call CSR or corporate responsibility. We have decided to name the idea of running a responsible business the triple bottom line. So it means that we operate with 3 bottom lines. It's also the way we report in our annual report once a year. And the idea is to try to balance, of course, making a profit with being environmentally and socially concerned and focused at the same time. This might sound easier than it actually is in running the business in our daily life, and we do encounter dilemmas in many areas. In the business ethics area, when we have to downsize our organization, when we build new plants across the world, we have to make sure that building a plant in China lives up to the same environmental regulation that we have in Denmark, and of course to the same health and safety standards as well. So we apply a set of very strict global standards across the world. We have also added the triple bottom line into the Articles of Association for the company in 2004 to make sure that everyone that works with the company and also shareholders that decide to buy shares in the company knows that this is how we operate, this is our modus operandi. And I'm also happy to say today that the company is doing very well financially, and we do believe that this is very much due to the fact that we run the company according to the triple bottom line principle. So what does social responsibility mean for a healthcare company like Novo Nordisk? It does mean, among many other things, that when we watch the diabetes epidemic expanding across the world, we think it's part of our responsibility to take action and be part of the solution. The numbers you see on the two sides of me, that is the data that IDF have just updated in their newest atlas. They update their atlas every second year, and the depressing thing is that the numbers get higher every second year. So the newest numbers that you see here is that IDF estimates that we have 366 million people with diabetes across the world, and that this number will grow to about 550 million in another 20 years. So we have a great challenge at hand. You might imagine that 90% of the people with diabetes across the world suffer from type 2 diabetes. And type 2 diabetes is to a certain degree preventable. So of course we have to address this challenge on many different parameters. One of my personal favorites is Kofi Annan, who we have had the pleasure of inviting to a number of our diabetes meetings across the world. And I think he puts in a very nice way that the diabetes pandemic has both a socio-economic element, a big challenge, but also a challenge of human suffering. And in his word, without tackling the diabetes epidemic, which is now gripping our world, we will, I fear, find many of our ambitions for the future simply impossible to achieve. So this is a call to action for all of us. And as a sustainability company, we are of course concerned with the next generation and making sure that we do our best to hand over the planet in a better state to our children than we received it from our parents. And what I would like to do in my little slot in the program here is to give you a few examples of how we try to address this challenge in Novo Nordisk, and of course in partnerships with patient organizations, with other companies, with international organizations, because no one addresses a challenge like this on your own. But let's revert to the diabetes pandemic. There are a certain number of things we have to do if we truly want to change. If we don't want just to continue watching IDF numbers grow every second year. And in my mind, some of the things we need to focus on is first of all to create awareness of the diabetes pandemic globally. We have much better awareness of diabetes today than we used to have 5 years ago. but we still have a challenge. We also need to focus on prevention and timely diagnosis to avoid complications. We need to improve access for everyone across the world, for people in the developing countries, but also for people in countries like Holland, Denmark, or the US that live in pockets where they don't have the same opportunities as the rest of us. Again, it can only be done in partnerships, in public-private partnerships. And also, the healthcare systems has to be able to address the need of the individual patient. And I'd like to say a little bit more about the importance of the individual, because we can, of course, talk about diabetes, pandemias, changing of healthcare systems, but what it really comes down to is the single person that suffers from diabetes. The model you will see here is one we have borrowed from the heart disease area. It's called the rule of half, and the idea with the model is to illustrate that you will start with a group of people in a specific country that has diabetes. Some of them might not know. And according to this model, we would say that a rule of thumb is that 50%, half of them are diagnosed. Again, half of them are treated. Half of these are reaching their targets. And again, half come to their desired outcome. So what would this mean if you put numbers to the model? Let me just give you an example. In Denmark, it is 6% that receive their desired outcome. In a country like China, it's 3%. And no matter if it's 3 or 6, it's a terribly low number. So there's a lot to do in diagnosing, treating, and improving diabetes care. As a company, we have taken the opportunity to add focus on patients into our Novo Nordisk way. That is the vision and the guideline for all employees in the company. Where we really have an opportunity to put a focus on patients is, of course, in our daily work, but it's also at the Steno Diabetes Center that some of you might know is situated in Denmark. It has a very long tradition as a research-based diabetes hospital, and a couple of years ago we took the opportunity to add a health promotion center to the Steno Center. And this was, of course, inspired by the fact that with the diabetes epidemic, with the knowledge that some of these diabetes type 2 cases could be prevented, we must research much more into what kind of education works, what kind of health motivation can make people control and maybe even avoid getting type 2 diabetes. So this is just one example of our contribution to prevention in the company. In terms of understanding the person behind diabetes better, Novo Nordisk established the DAWN study back in 2001. It was a psychosocial study of 9,000 people with diabetes from across the world. At that time, it was quite new to look at that particular aspects. But since the study was launched, we have basically created a movement that meet every second year to discuss the psychosocial aspects of diabetes. But there is a limit to how many years you can talk about the same data. So we have decided that we want to do a Dawn 2 study. It has started now. It will be concluded in 2013. Here we will expand the number of people with diabetes participating to 17,000, covering 18 countries. So this, we think, is a very important contribution to finding ways of putting the patient at the center of everything we do. One of the things I emphasized to create change was awareness building. Actually, I think it's less than 10 years ago that it really dawned to me and my colleagues in Novo Nordisk that we were facing a diabetes pandemic, that the numbers would go in the wrong direction so fast. But since then, we have taken the opportunity to initiate a set of awareness activities, of course, again, in cooperation with our good partners, the IDF and other organizations. And let me just give you 3 examples. You see a nice bus here. It has been almost 2 times around the world, visiting cities on all continents, inviting politicians, journalists, other important people to understand the diabetes problem. The bus is continuing now as a screening vehicle, so we still have a world tour going on, but it has been a really good learning process for us as well. In the middle, you see 2 people with the blue circle. And I can see that quite a few in the audience is wearing this circle. And I must compliment the IDF for having the courage to see if we could succeed in having the UN pass a resolution on diabetes. This was considered a mission impossible. But in 2005, the IDF succeeded. We were very proud to be there in the process, helping IDF in this, but it was a major step forward. And it does say in the resolution that every country has to celebrate the World Diabetes Day every year. So we are actually complying with the resolution by sitting here together. We have also taken the chance to invite politicians across the world in what we call Changing Diabetes Leadership Fora. We started in 2006 in the US, moved to Russia, China, the Middle East, Sub-Saharan Africa. Again, in partnership, again, just as a facilitator, but with a view to documenting how is the diabetes situation in your region, in your country, and what can be done about it. 20 different countries have had meetings like this and now have a very clear picture of what the diabetes challenge is. This might be a drop in the ocean, but I think it has been part, together with many other activities, to keep momentum going for important improvements. I also have to mention that there is, of course, a special challenge in the developing part of the world. When we talked about the diabetes increase in the beginning of the meeting, 80% of the increase is going to hit the developing countries and also the emerging countries. So we found it important to do a special effort for the poorest countries in the world and created the World Diabetes Foundation back in 2002. Novo Nordisk gave a donation up front. It's an independent organization, but it has been a great pleasure for all employees in the company to watch the foundation growing and to see that it is today the single largest initiative to support people with diabetes in the poorest part of the world. But what about the next generation? The diabetes pandemic should hopefully be slowed down, but it will hit the next generation anyway. We think that children with type 1 diabetes in sub-Saharan countries and in other low-income countries need special attention. The life expectancy of a child with type 1 diabetes in sub-Saharan Africa is less than a year. So we have joined IDF campaign of saving a child and made an ambition that in 2015 we want to supply 10,000 children with free insulin, with education for them and their parents, and support in their daily care. Today you can see the countries we have reached and that we have managed to enroll 3,000 children in the program. But I can assure you that in some of these countries this is not easy, but we are working very hard to reach the 10,000 that we set as a target. Finally, gestational diabetes is an area we think should have much more focus. We estimate that 5 to 10% of all pregnant women get gestational diabetes. We also estimate that if it's not treated, 20 to 50% of these women might develop type 2 later in life. We also know that overweight children born from mothers with untreated gestational diabetes have a higher risk of developing diabetes later in life. So maybe a focus on this particular theme could help us address the diabetes pandemic challenge. Maybe this could be the key to stopping or slowing down the pandemic. This is at least an attempt that we are going to do, again with good partners at the Steno Diabetes Center, the World Diabetes Foundation, and our attempt is to screen 35,000 women in Colombia, in Nicaragua, and in India, and also use these data to develop a health economic model of whether it actually pays off from a societal point of view to spend the resources of screening pregnant women. We feel very convinced, but you know, it's always very, very nice to have the numbers as well. So this is just to give you an idea of our journey for the last 10 years. We will continue in the next decade as well, because this is hard blood for, I think, all of us in the room. We were, of course, extremely thrilled when the UN decided to have a high-level meeting on non-communicable diseases, including diabetes, cancer, and heart disease. The meeting took place in September, a 2-day meeting for all state leaders across the world. And the political statement that came out of the meeting is something we see very positively. It was unanimously agreed by all the 192 state leaders that participated. And it does recognize that diabetes have become a disease of pandemic proportions. It does state that health promotion and prevention needs to take place in all countries. It does make a very close link between the health of any human being in their first 1,000 days and the risk of developing diabetes later in life. And finally, the declaration encourages all countries to set targets for their diabetes plan and for the results in terms of bringing down the numbers for diabetes. So that is the homework all the state leaders went back from New York with. And in another couple of years, WHO will convene a meeting to discuss the targets from all the countries and also global targets. And those of us that work for an organization knows that when you set a target and when you have KPIs and maybe even a balanced scorecard, things begin to happen. So our hope is that things will also begin to happen after the UN high-level meeting. The next destination we have is a Changing Diabetes Leadership Forum here in Europe, because we also need to discuss how we can improve diabetes care. The report that you have prepared for this meeting is an excellent and action-oriented document, but I'm not sure all European countries have the same. So, in April next year, we will have a pan-European meeting with all the relevant health ministers, everyone that are key stakeholders in this area, discussing prevention, health promotion, cost effectiveness that has come very high on the agenda for everyone, of early detection, and of course, how we can improve treatment and make sure that everyone that gets diabetes also have an opportunity of having a life with high quality. So, ladies and gentlemen, with these words, I would like to thank for your attention.
Thanks so much, Lisa. Can I have a seat? Maybe you want... Yeah, Lisa now.